कितले फ्रिक्वेंटली आमी डॉक्टर म्हळ्यार डेंटिस्टाक वचून मेळाचे.
इंडियन कशें कोत्ताय दू कल्लर मात घरा अशें कर रे तशें कर रे. थोड्यांनी म्हणचे ओ फिलिंगाक 600 रुपीज काण गेले डेसिमेटाड वचून ते 100 रुपयेक अर्दो किलो मेळटा. सकाळी उठून तक्षण वचून बाथरुमान वचून वचून सी वेस्टर्न सिस्टमांत दे डोंट वेक अप एंड दे गो अँड ब्रश, दे वेक अप एंड दे ड्रिंक अ कॉफी. ओके आतां बेसिस अशें आसता थोडेपणी अशें जातात. मागीर आनी अशें फूल बेंड जाल्या प्राणी आनी यूज करनासता. दॅट वन पर्सन इज मी ऑल्सो. ओके परत उडयले एक 4 वर्सां परत यूज केले ब्रश. अशें तर न्हिदेन थोडे पटी आमी and fast finish fast because so using the paste or using the brush, it's all depending on you on how you maintain your health. Do kailar matra dentist na other dentist चे ओळख ना.
Correct.
We don't go for preventive.
Correct.
We think 10 times कित्याक पयशे करसीचे म्हणून. गव्हर्नमेंट केदाला फ्री दितना आमी पळया म्हणून. डेंटिस्टा कडेन गेले तक्षण दांत काड. दू कailar दांत काड. Till 10 years of a child the parent has to brush. पहिले सकाळी पेरंटान ते म्हणूंक ना मागीर चॉकलेट केले गे ब्रश करू ना म्हणून. आमी बायले नेसान हाडटा वय गे न्ही 2000 3000 10,000चे वस्तू. बट वॉट अबाउट द हेल्थ कंडिशन.
करेक्ट.
हप्त्या केकांनी सदनाची जिनी कार्मेल कॅफे. हप्त्या केकांनी सदनाची जिनी कार्मेल कॅफे. कार्मेल कॅफे.
Carmel Cafe, a sip from the cup of life.
कार्मेल कॅफेच्या सर्वीक्षकांक म्हजो प्रणाम. हांव तुमची होस्ट लिझा रॉड्रिगज. ह्या दिसांनी बरी भलायकी जाय म्हण आमकां समेस्तांक गत आसा. आनी बरी भलायकी जायचे तर बरें खाण खायचें, एक्सरसायज करीचे, बरें रेस्ट करीचे हे सर विशय आमकां कळीत आसात. देखून बरी भलायकी म्हण सांगल्यार फकत कुडीची भलायकी मात्र गे. कुडीची भलायकी म्हणटना दांतांची भलायकी वा ओरल हेल्थ म्हणून आमी कितें म्हणटा हाची भलायकी सांबाळची भोव गरजेची. पूण सडावत जावन दांताच्या भलायकी विशयांत आमी इल्लेशे गमन दिवचे उडे म्हणून म्हजी पातयेणी. कित्याक दांत असचे खाली साबूंक आनी खावंक म्हणले थोड्यांची पातयेणी जावन आसा. तर दांताची भलायकी कशी सांबाळची, दांत कित्याक गरजेचे हाचे विशयांत माहिती दिवचे खातीर आज आमचे सांगाता आसात डॉक्टर केविन पायस. तर येया तांचे लागीं आज आमी उलया. डॉक्टर केविन तुमकां सर आमच्या विक्षका तर्फेन आमच्या टिमा तर्फेन ह्या पॉडकास्टाक हांव स्वागत म्हणटा.
दे बरें करूं.
कशें आसा डॉक्टर?
ऑल गुड. ओके आनी थँक्यू ह्या कार्मेल कॅफेन आपयल्याक तुमकांय. दे बरें करूं.
तशें तुमी एक डेंटिस्ट मात्र न्ही सांगातात ते एक पब्लीक हेल्थ ऑफिसर वा आमी खाले म्हणटा कम्युनिटी डॉक्टर म्हणून सांगना हांवें आयकलां. सडावत जावन आमच्या समाजांत एक थिंकींग आसा कितें म्हणून सांगल्यार MBBSाक सीट मेळनातल्यानी मात्र BDS करचे वा BDSाक आमी केदां एक सेकंडरी सीट वा लास्ट सीट म्हणून आमी चिंता. सो हाचे विशयान तुमचो एक कमेंट कितें?
हे सडावत कॉमन जावन आसता. सडावत पुराणेशींचे वय करेक्ट बिकॉज एकट्याक एक डॉक्टर जावंक एक आशा आसता. आनी आमी नीट पयल्यांचे आमी बरयतना सीट आनी पळय आहले. सो एक्सपेशली रँक प्रकार आमकां सीट मेळ्ळ्यार आमी काणकोणचे आहले. आनी नेक्स्ट थिंग एफोर्डेबिलिटीचे वयर कित्याक तातूंय कॅटेगरायजेशन्स आसतात. फ्री सीट गव्हर्मेंट सीट्स गव्हर्मेंट कॉलेजीसांक, मागीर फ्री सीट्स थोडे व्हेरी सबसिडायज सीट्स म्हणटात, मागीर गव्हर्मेंट पेमेंट सीट्स, मागीर मॅनेजमेंट सीट्स आसतात. ताचे प्रकार आमी एक पटी खंयचे पुरा ऑटोमॅटिकली सायफन एक्सपेशली यू लूक एट काय म्हणटात आमचे फायनान्शियल स्टेटस पळोवन या आमचे रँक पळोवन आमी सीट्स काण गेल्या उपरांत वॉट एवर सायफनिंग जाल्या उपरांत उरले. सो मोस्ट ऑफ अस आर इन दॅट वे. ओके एक आशा आसता एक डॉक्टर जावंक म्हळ्यार मेडिकल डॉक्टर जावंक. मागीर लास्ट आमी थोड्यांनी लायक ओके डेंटिस्ट आनी डॉक्टर जावंक DR मेळटा. ओके दॅट इज रूल. ओके सो देखून आमी ते काणकोणचे बिकॉज एनी वे डेंटिस्ट्री ऑल्सो इज मोर इनवॉल्वड इन क्लिनिकल एज वेल एज वॉट यू कॉल सब्जेक्टिव्ह एस्पेक्ट ऑफ पेशंट्स. देखून I would say that's why people take up. Next thing is that yes, like me also wanted to become a doctor. Then I said why not a dentist also? Because I've anga dentist kodyalan puleylar tedada you had very senior dentists. If you know, I don't want to take the names, but there are very senior dentists. Correct. Dekon te ek asha आली okay why not? Okay आणि dentist few that tedada pudetana mane when 2001 when I took up dentistry. Prominent एक कितली क्लिनिक आली.
करेक्ट.
ओके सो ते एक म्हणले ओके दिस इज वॉट आय कॅन डू. अँड नेक्स्ट थिंग ऑल्सो एफोर्डेबिलिटी. सीट पळयतना ओके फायन माय पेरेंट्स कुड एफोर्ड that. Yeah. And I said, why not go for it and take it up.
Correct. तुमच्याकडे विचारचे जाल्यार ओरल हेल्थ वा आमी दांतांची आमची भलायकी सांबाळची कित्याक तितली गरजेची?
इंग्लिशान सांगचें जाल्यार दी ओरल कॅविटी इज दी गेटवे टू युअर ओवरऑल हेल्थ.
करेक्ट.
ओके, हे फ्रेज सांगचें जाल्यार ओके. सो म्हळ्यार दांताचे भलाय या दांताचे म्हण न्ही, तोंडाचे ओरल हेल्थ म्हळ्यार तोंडाचे भलायकी आसल्यार बरें आसल्यार ते आमचे फूल काय म्हणटात जिवाचे एक पिक्चर.
करेक्ट.
एक पिक्चर दाखयता. एग्जाम्पल डायबिटीज जाल्ले या हायपरटेन्शन आसले तोंडान थोडे बडी कळटा.
करेक्ट.
करतना आमी ओके यू कॅन अंडरस्टँड दीज आर द क्लिनिकल फायंडिंग्स म्हणटात आमी.
करेक्ट.
तातूंत आमकां कळटा अशे पुरा कंडिशन्स. या थोडे पटी तुमकां कळना शुगर आसा म्हणून, तुमकां कळना बीपी आसा. थोडे मेनी पेशंट्स यंग पेशंट्स आमचे कडेन येतना वी टेल देम वाय डोंट यू गो अँड डू दीस टेस्ट.
करेक्ट.
अँड देन आफ्टर वी कॅन काय म्हणटात आमकां कळटा ओके अशें आसा तशें आसा गी यू नो. सो दॅट इज वाय ओरल हेल्थ इज व्हेरी इम्पॉर्टंट.
करेक्ट.
आमी चिंतशे काले स्माईल आसल्यार पुरो तुमचे आतां कॅमेरार दिसता ओके. कॅमेरान दांत सोबीत आसल्यार पुरो या कोणानी म्हाका तें कितलें ब्रश करचें मात्र.
करेक्ट.
बट इट इज नॉट दॅट. ओके, eating gives a sense of pleasure. Correct, no? For me and for you, I think we are taste, biting and eating.
Correct.
So they gives pleasure also.
Right.
So it is not only aesthetic. मतलब पोळोवचे मात look नहीं, but even when you bite your food, chew your food and understand, so that also gives some sensation, you know, happiness.
Correct.
Then afterwards, your tastes, your tongue, your cheeks, everything all have to work in unison.
Correct.
Unison, okay? That's why oral health is very important. Not only for speaking, see common, which I don't want to go too common because we are short of time probably, but you know, speaking, talking, laughing, all these are part of the mouth.
Correct.
Okay, without that then आम्ही just sign languages आणि या नेसान म्हणतात नाही आता birds पकाडे उठो मात दाखयतात. So this is what we do it from our mouth, talking, laughing, your beauty also comes. You know, some people are they look good with their teeth. So all these things matters.
करेक्ट. आता तशें म्हणटा आसतना आतां डेंटिस्ट म्हूण सांगल्यार सडावत आमी चिंतचे आसा की डेंटल प्रोसिजर्स सडावत आमचे इन्शुरन्सांनी कवर जायनात. आनी डेंटल प्रोसिजर्स केदाळे मस्त एक्सपेन्सीव एक ब्रेसस घालचे जावन दी वा कले प्रोसिजर डेंटल खंयचे चॅकअप करूंक वचनात वा तले कले करूंक वचनात. हे कितलें आसत तुमच्या प्रमाणे?
तुमच्या क्वेश्चनाचे फर्स्ट भाग पळयतना डेंटल इन्शुरन्स म्हणटात. डेंटल इन्शुरन्स युजली आमच्या इन्शुरन्स पॅकेजान मेळना. ओके, मेळना बिकॉज यू सी ओनली अदर दॅन व्हेरी हाय एंड इन्शुरन्स कंपनीज अँड होल बॉडी पॅकेज म्हणटाना अँड यू आर पेईंग अ हायर प्रिमियम त्या इन्शुरन्सान प्रॉब्ली मेळात. बट आमच्या डेंटल प्रोसिजर्स व्हेरी रेअर. बट आता थोडे इन्शुरन्सान इम्प्लांट म्हणले एक you know, because implant is costly.
Correct.
Okay, and if you are paying a very good premium, so that automatically implantaचे procedures आणि पुरा आणि dentures थोडे पुटी मेळचे चान्स असता insurance companies. Other than that, those companies where they provide थोडे companies they clause असता. म्हळ्यार if you don't come to the company smiling well, automatically their business also
comes down.
Okay, so they provide you some like dentures, removable dentures.
Correct.
Not fixed dentures because that is slightly expensive.
Correct.
Going to the second part, dentistry expensive gi. Wait, if you go for good quality.
Correct.
If you go to a qualified expertised person, automatically charges will be the same.
Correct.
काही सांगू ना कोणानी like charges इतले या तितले या असाचे म्हणून. बट येस रूल्स अँड रेग्युलेशन्स आयल्यात आम्ही KPMA प्रकार आणि पुरा चार्जेस आमचे दाखयचे. बट दॅट इज सब्जेक्टिव्ह चार्जेस. नो वेअर इट इज रिटन डॉक्टराचे चार्ज 100 रुपीज आसा जगे टू 500 रुपीज आसा जगे तशें इट इज सब्जेक्टिव्ह. सो यू पुट युअर चार्जेस इफ द पेशंट फील्स that the person doctor charges so much you can go to him. So dentistry why next thing chair आसत तुका कले म्हणचे जाल्यार 60,000 आतावन 10 लाख मुसर एक चेअर आसा एकच चेअर डेंटलाचे चेअर म्हणचे आमचे चेअर नाही.
करेक्ट.
ओके, सो डेंटल चेअर एक्सपेन्सिव्ह.
करेक्ट.
ताचे वयर डेंटल चेअर म्हणटा चेअर मात खाली मेळटा ताचे उपरांत एरोटर ताचे बर्ज मागीर मेटिरियल डेंटल मेटिरियल.
करेक्ट.
तुम्ही आता डेंटल मेटिरियल इंडियन प्रोडक्ट्स यूज केल्यार आय एम नॉट सेइंग दॅट दे आर सबस्टँडर्ड बट they have their own problems and issues.
Correct.
Ata we use R&D which are probably from abroad. Okay, some materials which they have good R&D मतलब research and development जाऊन products देतात. So those things are quite expensive because R&D त्यांनी spend केला.
Correct.
So they automatically the charges go there and then. So depend on the expertise of the doctor, depending on the amenities what he gives you. Okay. Next thing is the aesthetics of the clinic.
Correct.
And rent.
Correct.
Okay, which we always look at. Okay, that automatically तुमका एक posh clinic जाय या so by people feel like त्या clinic आ गेलो मका, and automatically you want to recommend that person. No, you feel like okay, I'm gone to a clinic which is, so automatically charges are,
Correct.
Those overhead charges fall in.
Correct.
So the dentist has to charge. So if you go to probably in a village and this is a good qualified BDS or an MDS person, they will not charge because they have to look at their surroundings.
Correct.
I, as a public health dentist, I have to look at my surrounding as a practice.
Correct.
And I have to look at people. I have not look at person.
Correct.
So you understand, I have to look at the public and then the person. So I charge accordingly. मुझे clinic अंत 1 lakh 1.5 lakh होने ना. And पुरांग सांगचे मुझे charges इतले. Because sometimes the poor person also might look at me and say this person is, charging me exorbitant. But when a person who is very affordable is saying, no, itlet ki doctor. So it is there. So
Correct.
dentistry, because of all these things, these 3 main issues could be expensive for some, and affordability is an issue.
करेक्ट. कम्युनिटी डॉक्टर म्हणून सांगल्यार काले ताका ताचे खातीर तुम्ही प्रत्येक कोर्स म्हणून कालें केला गे. सो कम्युनिटी डॉक्टर म्हणल्यार कळली पुरो जबाबदारी तुमचेर आसा. काले डेंटिस्ट्री मात्र गी तुमची रेस्पॉन्सिबिलिटीज पुरो काले आसा ते म्हाका इल्लें सांगतात गी.
Okay. आमचे बॅचलर्स जाल्या उपरांत आमी मास्टर्स करतात. ओके, वी हॅड स्पोकन लॉंग टायम बॅक अबाउट वेन यू हॅड कम अँड मेट मी. सो वी हॅव 9 different branches in our
Dentist.
master's program.
ओके.
Bachelor's करता आमी, it is general dentist.
Okay.
General become a general dentist. But specification आता म्हणतात. एक्झाम्पल आमचे तुमका ॲटलिस्ट MBBSचे डॉक्टरांचे दोळ्यांचे, किडनीचे, लंगाचे ते बरो करता. सो
Correct.
डेंटिस्ट्री ती मस्त आसा. आतां सडावत पुराक जाणवय आयल्या. ओके, पयले कॉमन म्हणटात रूट कॅनल आनी ब्रेसेसाचे तितले मात्र एक गुत आसतले. बट देर आर 9 different branches. So in that you have gummache doctors. आता cleaning कोणाकी नो जनरल डेंटिस्टाकी करियत. But there is a specialized person for the gums only. So periodontist म्हणतात ताका. Then you have a prosthodontist कोण दांत काडल्या उपरांत एक सेट बसीचे ताचे एक स्पेशलायझेशन एक आसा.
Correct.
Then you have endodontist, root canal and endodontist specialist. So those who do that yet you have orthodontist सरेंचे. Then you have community dentist.
तुमचे बरे.
तुमचे हांव तुमकां इल्लें मागीर सांगता.
okay, no
मागीर
problem.
you have oral pathologist. Okay, that they learn the anatomy of the teeth because they can utilize that for any condition there and there, like cancerous condition आणि ती पुरा पळयतात, oral pathology म्हणतात, or forensic तांकां यूज करियत.
Correct.
Then you have a pediatric dentist, you have there. So these are all the different branches which are available. And oral and I forgot, sorry, I should say the gateway is oral and maxillofacial, surgery and oral medicine.
Correct.
ओरल मेडिसिनच आसा. म्हळ्यार एक्सरे ताचे विशीं डेंटलाचे एक्सरे दुसरे. आमचे नॉर्मल एक्सरे न्ही. आमकां कित्याक लो डोजेज दिवचे, एकच पटी चड दिला मागीर तें प्रॉब्लम. सो दॅट यू हॅव ओरल मेडिसिन एंड दॅट ब्रांच यू हॅव ओरल सर्जरी, maxillofacial surgery,
Okay.
accidents and traumas and even दांत काडूंक, इम्पॅक्शन दांत काडूंक ती तांचे माहीत. So these are the branches which you have. Now going to community dentistry. Okay, there are 2 terminologies. One is community dentistry. पहिलेंचे आतांचे terminology public health dentist.
Public health dentist. Okay.
Same community public. Now तांतूंत आन्सर आयले.
Correct.
म्हळ्यार एंडोडॉन्टिस्ट म्हळ्यार तुज्या एकच दांताक तो पळोवन रूट कॅनल करता. वय गे न्ही.
वय.
पब्लीक हेल्थ डेंटिस्ट म्हळ्यार हांवें कशें तें रूट कॅनल पब्लिका वटू करचें म्हणून. इन द सेन्स हाऊ कॅन आय डू अ प्रिव्हेंटीव वे.
Okay.
हाऊ कॅन आय गिव अवेअरनेस
Correct.
that if this problem is, so I look at not 1:1, but I look as 1:many.
Many. Correct.
So mine is an awareness program. Mine is काले म्हणतात आमी जाणवाय दिवचे लोकांक. Like as today you have
Correct.
opened it
Carmel
up.
Cafe.
As opening तुमचे आले आमी जाणवाय घेवंक आमी आयले हांगा ओरल हेल्थाचे विशयन. So
Correct.
this is what we do as public health or community dentist. We do work for the community. The same thing is there in medicine.
Correct.
आता मलेरिया कंट्रोल प्रोग्राम जावन दी या TB कंट्रोल प्रोग्राम जावन दी कम्युनिटी मेडिसिनाचे सांबाळटात.
Correct.
तशेंच आमी दांताचे आता दंतभाग्य स्कीम आणि पुरा
correct.
पब्लिक हेल्थ डेंटिस्ट. दिस इज वी लुक ट्राय टू गेट एन अवेअरनेस. तुमकां दांत कित्याक जाय तुमी स्टार्ट केल्ले बरी दांत काल्याक जाय म्हणून.
Right.
सो that is the thing which motivates people to better their ओरल हेल्थ
करेक्ट
ते आमचें काम. सो होपफुली आय हॅव सॅटिस्फाईड.
येस.
Yeah.
आता चढावत आमी ल्हान आसतना इस्कॉलांत आनी पुरो आसतना चढावत ते डेंटिस्ट आमच्या इस्कॉलाक आनी पुरो येवन आमकां टूथपेस्ट ब्रश आनी पुरो दिवन कशें ब्रश करचें आनी पुरो सांगताले. सो बेसिकली ते काम एक पब्लीक हेल्थ डेंटिस्टाचें.
करेक्ट, that is you come to the point.
ओके. सो नॉर्मली एक जनरलायज तुमी पळोवचें जाल्यार कितले नमुन्याचे ओरल इश्यूज हेल्थ इश्यूज आसूंक पुरो. सो ताचे विशयान म्हाका इल्लेशें नॉलेज दितात.
तुमकां तें सांगचें पयलीं हांवें सांगचें जाल्यार
अहा.
आमी आमच्या जिवेचे विशयन कितले गॅरंटी दिवंक जाता.
रायट.
आमी आज आसा,
फाल्यां ना
नेक्स्ट सेकंड आसा की
तें गुर्तूना.
ओके. आल्ल्यारी आमची ल्हानपणांतल्यान व्हडपण प्रायज जाता मसूर या यू नो टील वी मीट द एंड वी हॅव स्टेजीस.
करेक्ट.
तशेंच दांतान ती ओरल हेल्थ आनी तशेंच स्टेजीस आसात.
करेक्ट.
सो दॅट वॉट यू आर टॉकिंग अबाउट इज what do you call not genetic makeup but it is a normal flow of life.
करेक्ट. ओके.
So थोडे फाटी दांत चुबीत आसतात यंग आसतना ऑटोमॅटिकली आमचे खावचे प्रमाणे यू नो द युजेज म्हणटात आमी कितले यूज करता दांत जरून वेता. ओके. ब्रश केल्ल्या प्रमाणे कितले म्हणजे ऑल युजेज.
करेक्ट.
ते पुरा तशें ऑटोमॅटिकली अशें इटींग स्वीट्स यू टोल्ड कॅविटीज ये पुरा ऑटोमॅटिकली इट गोज लायक दॅट इन दॅट वे. हेरिडिटरी येस देर इज हेरिडिटरी दॅट इज जेनेटीक मेकअप. जेनेटीक मेकअप म्हळ्यार थोड्यांचे काय कोते इन द फॅमिली मे बी सम डेफिशियन्सी ड्युरींग प्रेग्नन्सी सम डेफिशियन्सीज अँड ऑल दीस थिंग्स कम इन टू द पिक्चर. ते जाल्यार टीथ ऑर ओरल डिफॉर्मिटीज टेक प्लेस. ते जाल्यार क्लेफ्ट मी पळयल्यात आसतले क्लेफ्ट
म्हणून आमी काल सांगताले.
वय मागीर ऑल दीस थिंग्स मागीर देर आर अदर थिंग्स वीच आर एनवायरमेंटल.
करेक्ट.
फ्लोरोसिस म्हणटा थोडे फाटी तुमी बिदर गुलबर्गा आनी परत तशें गेल्यार या इवन आमच्यान कोण बोरवेलाचें उदक पियेता चडावत पळयल्यार तो एक फ्लोरायड ते केल्ले चड आसता. आतां आमी क्लोरीन घालता उदकाक क्लीन करूंक तशें एक फ्लोरायड म्हणलें एक एलिमेंट आसता. सो दॅट ती चड आमी कन्सम्पशन चड जाल्यार ऑटोमॅटिकली ती धोवे धोवे लायक fluorescent tube light.
Correct.
Okay, it looks like that. Okay, so these are all different things. So that is why tooth on usage कितले यूज करता कशें यूज करता म्हळ्यार खावचे वयर पिवचे वयर कितले ऊन थंड हें देन इट गोज ऑन. सो ऑटोमॅटिकली कोणी पेशंट्स आयिल्ले म्हजे कडेन दांताचे प्रॉब्लेम जाल्ले डॉक्टर हें पयले खंयचेंय नातले. हांवें सांगचें जाल्यार तुमी आतां स्टिलाची बोशे काडल्या या स्टिलाचे डब्बे हाडटात तुम्ही यूज कर म्हणून एक कडेन पुटना गे ताका कित्याक सांगिनात तूं. ओके. सो ऑटोमॅटिकली दांत तशेंच इट इज नॉट गोइंग टू लिव फॉर एवर.
करेक्ट.
ओके. बट इट इज देर यू नो especially okay dentists are there to help you out to use it to the maximum. To the fullest to the use it to the fullest so that guiding the person so that पहिले डेंटिस्टा कडे गेले तक्षण दांत काड दुख आयल्यार दांत काड. आता डेंटिस्ट्री ट्राय कन्विन्स करता ओके तुका रूट कॅनलाक वचीत गम सर्जरीक वचीत कशें जाल्यार एक 2-3 दीस अशें दोन एंड यू नो यू कॅन prolong it. So that is one advantage. Putting removable dentures or putting fixed dentures or the implants and pura. So this is how we prolong the expectancy of the tooth. So that's why nomni musta asat. Sangun gelar you know it goes long. But as you know every amche skin darle skin nache mustu issues astat.
Correct.
Okay. The same thing with the tooth. The tooth itself has a lot of issues.
Correct.
From decay, cracked tooth syndrome. Okay, they pura many things. The gums itself has lot of issues. Bitarle danta कोण support करता? Hard.
Correct.
हाडाचे मस्त issues असतात थोडे.
Right.
Okay. I'm just saying from basic pain to cancerous condition.
Correct.
Okay, don't get frightened. Okay. But त्याचे मध्ये पुरा असता. So you remember this thing. We have skin, we have tooth, okay, and we have the bone.
Correct.
So we have to look dentist वशे पळयचे dentistry and especially saliva and all that thing पळयचे glands lymphatic systems आणि पुरा ते आम्ही पळयतना holistic so any of these derangements on these will cause any issue so and we as a dentist look at that.
कितले फ्रिक्वेंटली मी डॉक्टर म्हळ्यार डेंटिस्टाक वचून मेळाचे ते मेळचे कंपल्सरी जायचे की ते काल्याक ताचे विशीं म्हाका सांगतात की डॉक्टर
इंडियन कशें कोत्ता दूख आल्यार मात्र.
करेक्ट.
we go for tertiary issues.
करेक्ट.
we don't go for preventive.
करेक्ट.
इम्युनायझेशन आमी भुरग्यांक एक शॉट दिवंक जाल्यार वी थिंक 10 times कित्याक पयशे खर्चीचे म्हणून गव्हर्मेंट केल्यार फ्री दितना आमी पळया म्हणून.
करेक्ट.
तशेंच विथ डेंटिस्ट्री ऑल्सो इज द सेम थिंग.
रायट.
दूख आयल्यार मात्र डेंटिस्ट ना जाल्यार डेंटिस्टाचे वळख ना.
करेक्ट.
पास जाता 73 उठात ऑन.
रायट.
ओके. दुखल्यार मात त्या दिसा ताची डेंटिस्टाची वळख.
करेक्ट.
आनी म्हणचे जाल्यार आमी हांवें हर एकल्याक सांगचें जाल्यार आपले बर्थडे येताना ते दिसा एक फूल बॉडी चेकअप,
रायट.
बिकॉज आफ्टर 25 इट इज गुड.
आता करंट सिच्युएशन 25 जायजेत.
So I say after 25, one, gift yourself.
करेक्ट.
आम्ही बायले नेसान हाडटा वय की न्ही 2000, 3000, 10,000चे वस्तूर. बट वॉट अबाउट द हेल्थ कंडिशन?
करेक्ट.
सो तशें वन ओरल हेल्थ एक डेंटिस्टा कडेन जस्ट वचून एग्जामिनेशन कर, एक 200 रुपये मे बी 500 रुपीज मॅक्स.
फादर मुल्लो सांगता ते फ्री ओपीडी गेले.
येस, ओपीडी कायल्यार मिनिमल कन्सल्टेशन्स एंड ऑल दॅट थिंग.
करेक्ट.
So gift yourself that one, and that too, as you said correctly, what you mentioned is right. Abroad, once in 6 months, आम्ही
Correct.
advice करता. Textbook प्रमाणे once in 8 months आयल्यार it's okay. But at least an optimistic condition म्हणल्यार एक once in a year. That's what I say on your birthday. Gift yourself health.
करेक्ट.
Especially after 25, gift yourself health. Parents of children should look at their children in the way like मागीर डॉक्टर चॉकलेट भुरगे वस्तू खावन नासता, ओके, या ब्रश करना. Why don't you get to the dentist? So the dentist can guide the child.
Correct.
Sometimes dentist बे आसता भुरग्यांक,
वस्तू बे आसता.
सो एटलीस्ट ते ताका ब्रश करतात. ओके. हांवें सांगचें जाल्यार मोस्ट जाणांक एक्सपेशली धाकट्या भुरग्यांक टिल 10 years the parent has to brush at least once a day. Till 10 years of a child the parent has to brush. फाल्यां सकाळी पेरंटान ते म्हणूंक ना मागीर चॉकलेट केले गे ब्रश करू ना म्हणून.
करेक्ट.
सो दॅट वाय बिकॉज डेक्स्टेरिटी हेजे. नेक्स्ट थिंग काय ते आमचे फर्स्ट मोलार एपियर जाताना दांतांत ते केले डेक्स्टेरिटी ते उणें आसता, ते पाटी वचना. म्हणल्यार त्या भुरग्यांक सकाळीच्या न्हिदेंत या रातीच्या बिगी वचून आमसोरान म्हणचे थँक्यू व्हेरी मच, त्या आमसोरांत ते डेक्स्टेरिटी आनी ते लेंथ मेळना. So at least when the parents पळयतना समा ओके वयर आसा हें गरीचे तशें गरीचे ऑटोमॅटीक ते. सो दॅट इज द डिपेंडिंग ऑन द गार्डियन ऑर द पेरेंट्स.
करेक्ट.
वडिलांचे आय टोल्ड यू नो आफ्टर 25 एटलीस्ट दे हॅव सम अर्निंग्स. ओके, 25 जावंक जायना, बट एटलीस्ट देअर पेरेंट्स शूड टेक more care. So this is what I'm saying. So once in a year gift yourself health in any way.
राईट. आमच्या घरान येवन आमचे ब्रश पळयले जाल्यार टूथब्रश पेरंटाक ब्रश कशें करचें म्हणून गोत्तो ना. ब्रशिंगाक येता आसतना वॉट आर द फंडामेंटल्स ऑफ ब्रशिंग, म्हळ्यार ब्रश कशें करीचे एक. सेकंड थिंग ब्रश कशें चूज करीचे, भुरग्यांक जावं दी व्हडांक जावं दी, पेस्ट कसो चूज करीचे तुज्या हाच्या प्रमाणे, ताचे विशयान म्हाका नॉलेज येता. या बेसिक क्वेश्चन.
येस. ओके, गोईंग फॉर ब्रशेस तुमकां गोत आसा ल्हान भुरग्यांक युजली आमी निज्जी म्हळ्यार जल्मल्या भुरग्यांक निज्जी एटलीस्ट कॉटनांत once or twice in a day wipe करूंक सांगता. I think pediatrician says that. Okay, same warm water, just clean up the gums. Why? Because दूध पिऊन असता ते दूध थोडे पटी अंटाता and it is not good to keep something for a long period of time.
करेक्ट.
So that is one it starts from there. मागीर thumb brushes तुम्ही पळयले सिलिकॉनाचे brushes, then we start with that. Once the tooth starts coming after the 8th month, then we start with that slowly.
Correct.
Then it goes to kids brushes. You have these आमचे कले year प्रमाणे ने 2 to 3 years या 3 to 4 years असतात ने. So you start with those brushes. Okay. And most of these brushes are soft brushes. Most of these brushes soft brushes असतात. When it comes to adult brushes, there comes the problem. तुम्ही सांगल्या प्रमाणे hard, medium, soft, ultra soft मिळता. Now usage depends on what purpose and how do you want to clean, because आता हार्ड ब्रश दोज पीपल कोण पुरा गुटका तंबाखू आनी थिंक आता ते काले पुरा अंटाता तांकां हार्ड ब्रश थोडी पिटी जाय म्हळ्यार टू रिमूव द स्टेन्स.
करेक्ट.
ओके, दे रिमूव द स्टेन्स. बट नॉर्मल पीपल लायक हू डोंट consume other than tea and coffee which is staining, who eat normally, who
sticky food कोण सर
खायना and all that thing, not only sticky, the staining food and all that thing, a medium brush would do. Next thing, how much pressure you apply on the brush.
Correct.
The simple technique is that when you place the brush on your nail bed, it should not cause blanching. Blanching muntana ila damtana pade dovez itsane. That is the pressure.
Pressure padunaz. Correct.
So when you see I'm just applying this, it blanched, see?
Correct.
So it should be that pressure.
Right.
So that pressure they should not apply. Kada gota hai dantak duk kalna, pressure kalna.
Right.
Okay, it is literally a bone, right?
Correct.
It's like a mineralized structure. Taka nerves bitar asa.
करेक्ट
ते घासून 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 गुमटी कातरता मसूर आणि मागीर ते गुमटी दिसता तेन्ना मात कळटा ब्रश लागला म्हणून
Correct.
ना जाल्यार ब्रश कळना आमकां सो
Correct.
नॉर्मली आमी बरें
बंद घासतात.
सो दॅट शूड बी अवॉयडेड.
करेक्ट
नेक्स्ट थिंग देर आर मेनी डिफरंट वेज ऑफ ब्रशिंग टेक्नीक म्हणल्यार एक एकल्यांनी काले म्हणल्यार इनोवेशन कना कोंकणीन काले म्हणटात आमी
नवे नवे तरीके इनोवेशन केला
ओके सो इनोवेटिव्ह वेज ऑफ ब्रशिंग म्हणटात ते आसात लायक बास टेक्नीक मॉडिफायड बास टेक्नीक फोन्स टेक्निक्स फॉर चिल्ड्रन ओके ते तुमी यू आयदर यूट्यूब या तुमच्या डेंटिस्टा कडेन वचून कशें एक शिकाचें सी दिस इज वॉट द डेंटिस्ट विल टीच घरा अशें कर रे अशें कर रे तशें कर रे तितलेंच ओके सो दॅट इज वॉट वी लर्न
करेक्ट
बट वेन दॅट्स वाय तुमी सांगले प्रमाणे स्कुलांत या आमी वता especially pediatric dentistry or community dentistry, go to the community and teach them how to brush.
ब्रश करेक्ट
So now again I told you how the brushes go, how the implementation of brush and the technique. You can do that. And so this is what with the brush. Next thing is the paste. भुरग्यांचे पेस्ट आमी युजली तुमी पळयल्या प्रमाणे फ्लोरायड ना तातूंत
करेक्ट
काल्याक म्हणटात बिकॉज दे हॅव स्वॉल्विंग टिल 5 years of age they tend to swallow. देखून थोडे पटी आमी कितलेय आमचे एडल्ट पेस्ट यूज करूंक ना भुरग्यांक
रायट
why because and especially when the adult toothpaste have fluoride which is not good for the child because ताका skeletal deformity आणि दुसरे परत nervous issues जावंक पुरो so that's why आमी त्या पेस्टान पुरा फ्लोरायड आणि यूज करना that is a more of a cleaning paste
करेक्ट
okay so that is why आमी even if you are using थोडे कारण खातीर people use the adult paste on the child त्या झाडां तुमी एक जागृतकायेन तांकां भुरग्यांक सांगिचे एटलीस्ट स्पिट करून गिळ नाकात स्पिट करून सिक्केल पडून एटली ब्रश करून एटलीस्ट सो दॅट दे स्पिट आउट देर इज नॉट नो चान्स दे शुड नॉट बी एनी चान्स ऑफ स्वॉल्विंग एडल्ट पेस्ट
करेक्ट
दॅट्स वाय भुरग्यांक तांचे पेस्ट म्हणल्यार बारीक कशी
करेक्ट
आमगे
रिजल्ट मामा वो फ्लेवर जाय तो
फ्लेवर जाय ओके म्हजे चेडवां आतां व्हड जाल्यार मागीर तांकां जोर केल्यार आतां तुमी व्हड जाल्यार तुमकां गुत्ता तूं करूंक ना गागल करूंक गुत्ता तुमकां मागीर तांकां ते भुरग्याचे पेज म्हळ्यार त्यात गमी
टेस्ट
chewing gum flavor they flavor that is there so that is there how we proceed then we go for pastes which are fluoridated and non-fluoridated usually ayurvedic pastes and all that thing are supposed to be non-fluoridated they say any other branded which you get company paste and all that thing are fluoridated paste the fluoride kalak jay म्हळ्यार आमचे दांताक एक protection
layer correct
so protective layer करूंक म्हळ्यार we are not exposed to that much of fluoride in our water or eating or something like that so that's why we place it topically they place करता आमी that fast reaction जाता दांता वटू and it forms a little bit of protective layer
right
now then comes that those are the normal usage paste that is everyday usage paste
correct
then you have medicament paste
correct
like जुम जाता ना एक ऍड येता ने तो कळले ने
आम्ही ब्रँड सांगिना ब्रँड आम्ही प्रमोट करता sensitive gums
so that those are medicated pastes okay which are available and that you apply you keep that has a different procedure okay that you keep it there for some time so these are the things which are available so using the paste or using the brush it's all depending on you on how you maintain your health
correct
oral health so the usage आराम से सकाळी उठून तक्षण वचून बाथरूमान वचून see in the western system अंत they don't wake up and they go and brush they wake up and they drink a coffee
correct
okay they wake up and they drink a coffee they are alert then they have their breakfast and then they go for brushing
I do that
कोणी स्वप्नांत जोईनात
correct
कॅव्हिटी जावनचे या निजेचे प्रॉब्लेम जावनचे आमच्या फूड इम्बेडमेंटान म्हळ्यार त्या दांताच्या भितर वचून रावुरले थंय या शुगरी स्टफ रावुरले थंय ऑटोमॅटिकली थंय इट इज अ फोकाय ऑफ इन्फेक्शन
करेक्ट
ओके तुमकां गुत्ता काली म्हणी भायर दवरल्यार ताचे दोन बॅक्टेरिया आसता ती ग्रो जातात
करेक्ट
सो सेम थिंग वॉट एवर फूड वी हॅव इट एंड देन इट कॉजेस इशू सो इन केस इन द नाईट यू ब्रश युअर टीथ व्हेरी वेल फ्लॉस करीचे म्हणजे दांताचे मध्ये बिकॉज ॲज यू एज दांताचे गॅप सुट्टा सो दॅट यू फ्लॉसिंग व्हेरी इम्पॉर्टंट सी दॅट एव्हरीथिंग कम्स आउट देन you brush your teeth and then gargle your mouth again and then you go to sleep so morning as soon as you wake up zaigi brushing so that is so that's what I'm saying why because as soon as you wake up we khale gote asha to needin thode bati ami and fast finish fast because for the ladies it will be like ranchu kuda vasu kasa, for the men it will be like car doon kasa gite vasu kasa, it is that.
Correct.
It is that. So instead of that, make yourself alert.
Right.
Okay, best trick, just put your finger, you can just gargle because it comes kalagutte
utla
habit.
kaande unnadu kaande unnadu.
So just brush, at least gargle your mouth, clean it, have your breakfast, have your meal, then take time to brush your teeth. Take time so that everything goes off. Food allar, see cavities on kashe, food, time, tooth.
Correct.
Food, time, tooth. एक कार्ड टाइम कार्ड म्हणल्यार त्या फुडाक टाइम दी नाही बसूंक दांताचे वयर, ऑटोमॅटिकली कॅविटी जायना.
Correct.
इफ यू रिमूव फूड एंड टाइम, नो प्रॉब्लम, दांत क्लीन जाल्यार ब्रश करना अशें फूल गांव भोंवन ये कॅविटी जायना.
Correct.
सो यू अंडरस्टँड नो, टूथ ना जाल्यार काय जायना. ओके, सो नो कॅविटी.
No cavity.
No cavity at all.
Problem ante na, tooth problem ante na. Right.
So in this issue, if you remove the food particles automatically and brush properly, because all teeth have different surfaces. तुम्ही YouTubeवर वचून पळय येता, learn because that will automatically help you in protecting your tooth for a long period of time.
Correct.
And if there are issues when you go to visit your dentist will say anga asa problem, there is a problem, that is can improve yourself.
Correct.
So
right.
that is what.
Yes. So toothpick use करचे healthy गी, फ्लॉसिंग कशें करचें आनी काल्याक करचें, आनी अर्ली पुरो ब्रशेस डिफरंट टायप ऑफ टूथपिक्स काले आसात ते केदाळ यूज करचे, कोणे यूज करचे, कशें यूज करचे, हाचे विशयान म्हाका इल्लें तुमी सांगतात की.
टूथपिक तुमी सांगले वुडन टूथपिक्स आनी पुरो आमी which we see, it is better to use it for housey. Okay.
Right.
Why? Because earlier boppina, safety
pins.
boppina, safety pin pura kartile why. But usage even that I'm not saying, because see that time dentists also were less few, awareness was less, so kalamudi shirkaler maybe from ancestors or great ancestors also used to do that when the correct. But then afterwards you have to realize that सेप्टीक जावचे चान्स आसता. आमी म्हणचे पयले बेश्टे तरी नाकची घालनाकात भुरगीं, गोरपी नाकात ते, ऑटोमॅटिकली दीज थिंग्स आर नॉट क्लीन ऑर स्टेरायल.
करेक्ट.
ओके, सो दॅट यू कळ्ळें गो, थोडी एक टूथपिक दवरचे, तें पिक आनी एक फावटी यूज, एज यू टोल्ड नो, ते कट्ट जाता, रिपीट जाता, दॅट इज द वन थिंग. ओके, दॅट इज वन थिंग, यू यूज दॅट. नेक्स्ट थिंग वूड, आतां आमी म्हणटा चॉपिंग बोर्ड वुडाचे यूज करूं नजो म्हण, बिकॉज बॅक्टेरियल ग्रोथ असता. ओके, एक्सपेशली फॉर सॅलड, कुकिंगाचे जाल्यार ओके, कटिंग बोर्ड ते यूज कर, म्हणजे ते कुकिंगान ते डिस्ट्रॉय जाता. आतां सॅलड केल्ले तेत्त बोर्डांचे इन्फेक्शन क्रिमीगळोक तुमी तुमच्या सॅलडान घालना तेय खातात. ओके, सो इट दॅट्स वॉट द थिंग ऑफ टूथपिक्स आर देर, ऑफ वुडन टूथपिक्स. देर आर प्लास्टिक्स नाव अवेलेबल. Plastic, you have to be also one thing good as though environmental friendly. You have to, if you have that nature, plastics is a big, but the usage is little bit longer way. No, to keep it clean, use it. Then you have floss. Correct. You have dental flosses which are either you get the threading cut karna use kar, they use karungo ta such. Remember, everything you have to know how to use it.
Correct.
Your gums will be in a better position.
Correct.
Okay, like as I told you, blanching effect, okay, of the brush. You don't go much more beyond that. It's not required. Correct. The same thing with tooth. Culture sickle ani what church ani.
Correct. They cut
nijji damage zata. Nijji damage zao. It goes on. Okay. Correct. So cannot explain much, but I'm telling you, use it. How you use it, it matters. To see that way, floss use kariche, you get the prefab flosses. आता ऑनलाइन म्हणल्यार एक बॉक्स मेळटा 320 or how much ever the money is, you get that, you can use that, and you can use it multiple times. I always tell my patients, because we go for functions, we go to work and all that thing, if not a brush, carry a floss, that pre-knit floss. Wait, bagandor clean kar mat sabun every time before using it, wash it, then clean it up so that it removes all the food particles. Correct. And then gargle your mouth vigorously. Correct. Barekan, don't 3-4 times you gargle so that nothing remains, and then you keep your oral health good. So that's why about flosses there is lots to talk, but these are the simple things which I'm doing. So don't use emergency, I am not saying don't use, but at the same time when you have an opportunity to use the better thing, and it's affordable now. At a bottle brushy melta, 30 size. Yeah, that is also very good. It is like cleaning, but you need patience. That you get plastic nibs. okay, which you can clean up. So those are good for elderly people because ते बसल्याकडे इकडे म्हणे करून जाय.
काही ना काम ना
So if you want, you can use those. So
Right.
yeah, but remember, better to use something which is today than what was yesterday.
करेक्ट.
So materials which are available and they are all affordable.
Correct.
All are affordable. It is not that, and moreover, it is sometimes home delivery also.
आता होम डिलिव्हरीचे कसं सो डेंचर यूज करतल्यांनी ते डेंचर कशें क्लीन करचे कशें घालचे आनी ताचे कशें सांबाळचे लॉंग ड्युरेशना खातीर ताची एक नॉलेज म्हाका दिता गी डॉक्टर.
Dentures, fixed dentures and removable dentures
Removable,
asतात. Okay, removable also are partial dentures or full dentures,
Correct.
complete denture. म्हणटा तशें. So now fixed dentures are गोत्ता दांता बरी क्लीन करीचे मात there is swishing जायचे म्हणल्यार ताचे पोंदा बसून पुरो वचून क्लीन करीचे. ओके तें आसा. विथ रिमूवेबल dentures एक वड आसता तांकां दोन सर्फेस आसात. डेंचराक दोन सर्फेस आसात. वन इज दी what do you call tooth surface and one is the
Palate
gum surface. Oh, simple language and something. The gum surface. कंचे गम्माच्या वयर बसता.
ओके.
ते गम्माच्या वयर अशें बसता. करेक्ट ना? This is the tooth हांगा. देखून हे this is for the common this one I'm using common terminologies. This is a tooth surface and this is the gum surface. Now हे आमी ब्रश करियेत. Door ni brush करीत. आमी पेशंटाक सांगचे. But even you put your complete denture saying correct because one patient feels it is my own.
Correct.
I always tell don't take denture म्हणणे हे मुझे दांत. Automatically acceptability and happiness all thing comes in.
Correct.
The moment I say that it is dentist and केल्ले त्याने केल्ले म्हाका साबोंक जायना म्हाका टेस्ट ना ते जायना. So accept it. So you brush your teeth in that way. But the inner surface, it is always better to use cotton or a piece of very soft cloth with little bit of liquid soap. Nowadays it's available that you can clean. Then once in a night, as you say, once in a while you can use the mouthwashes, a little bit of mouthwash in that. You can keep the denture.
Dilute.
Diluted
one, not strong one.
Not strong one, not strong because it has its own chemicals which will denture is a plastic material. Damage chances. And then after you will have the whole, every time you will feel the thing.
Burning sensation.
Yeah, so for that reason you can use it or salt water. Even keeping it in salt water also, it'll help the things. Then you have tablets and available denture cleansing tablets. Ek ino bari. Ek galyar utkan pulav and you put your denture and close the bar. Next day morning you can remove it off because it reduces the amount of bacterial growth on that denture. So these are available. This is how you can maintain your denture. So remember there are two surfaces. Two surfaces require two different ways of cleaning. Correct. But a denture as a whole you can put it as in the denture cleansing tablets. Cream meltata. All you have. So that's why I told with the development of technology and different aids, automatically it is going on. The process goes on what you want you can buy. But common techniques also help.
I mean toothbrush विषयात वडलो उलो ना. केदाळा पुरा आमी टूथब्रश चेंज करीचे. आमी केदाळा नवो टूथब्रश काडून घेजे म्हणून सांगून आमकां फील जाता मुशेर मी राखून रावचे की व्हॉट इज द नीड. सो त्याच्या विशयान म्हाका सांगतात की
toothbrush according to a study because I don't want to quote, okay, it is as dirty as your toilet seat.
Right.
Even your mobile they say also is as because too much of exposure then what all we touch God knows where and when. Toothbrush one issue is that it आम्ही उदक असतात आमचं ते ब्रिसल कितले तू हें कर ते केले उदक असतात मॉइश्चर असतं. सो ते उदकानं ऑटोमॅटिकली इफ देर इज even little bit of the paste might be having a little bit of sugar in that, so that all the thing may harbors growth.
Correct.
Okay, आता ब्रिसल्स असे असतात थोडेपणे असे जातात मागीर आणखी असे फुल बेंड जाल्या प्राणी आणखी यूज करना असतात. दॅट वन पर्सन इज मी ऑल्सो. ओके
as a dentist.
no as a dentist. पोरत उडयले एक 4 वर्सां परत यूज केले ब्रश. Then I should not say that. But yes, I do. We keep another brush. I always keep another brush because sometimes the comfort of your old brush is that when the feeling. No, that's I have that. I have sentiments with sometimes the brush. But I use a new brush. Okay, so that it's like that. Then I feel that okay. So it is as you said. Remember, use your brush. Probably around once in 3 months it is better to change a brush because of this thing. If you're not changing also, I'm not saying that if it is good, if your bristles are little bit frayed, it's not gone more than 12 degrees or something like that, you can, as you said, for your denture the mouthwash या salt water and एक पड़ी clean करीजे. Very important. Soap, you have antiseptic soaps nowadays.
Correct.
Clean the brush and then place it back.
Correct.
So at least the bacterial growth is reduced.
Reduced, right.
Always wash your brush before you usage also.
Correct.
Because थोडे पटी cuts असतात and induced. Why do you want to carry something and place it in your mouth?
Correct.
Hopefully everybody uses single brush, not the whole one family one brush. Toothpaste का बरी नहीं है. So they are a problem. Okay, so that is
No,
why
that is there,
that
correct.
is there. So most of us are using nowadays brushes are affordable.
Correct.
It's okay. Now because of affordability, people are changing brushes also, because nowadays you get a pack of 4 or 5 for 100 rupees or less than that also you get. So nowadays people are using, but remember those brushes sometimes are very hard. So
Correct.
that you. So remember, changing of brush depending on, first, as we as dentists, the tenure of longevity of the brush, meaning for how long you have used the same brush, 3 months, 4 months. But next thing is the bristles. The more it frays, sunflower, okay, आम्ही सोडून
सोडूनच.
okay, because that the effect असana.
Correct.
It is like washing आमचे टाइल्स हे केले वॉश केल्यार त्या जाल्या टाइप ब्रशार काही क्लीन जाता.
जायना, correct.
Okay, so the same thing, it's the same concept, you know. So this is how you change your brushes. Okay, there is a little bit more also to talk about it, but for this simple, these thing, longevity and how you maintain your brush is very important.
Correct.
Clean it. ब्रश केल्यापर्यंत ते टूथपेस्टाचे काम करतात, त्यांचं धुवचे नाही, ते साबू म्हणून धुवचे नाही.
Correct.
You have to
Clean your toothbrush also.
clean it with the disinfectant solution or water, and then keep it back, so that it, and keep it in a place where it can dry.
Correct. तर ఇప్పుడు कॅप्स मेळटात ते कॅप्स घालून दवरल्यार
I would suggest keep it open.
keep it open.
Keep it open, because
Why?
why? Because see, it's the moisture remains inside.
Right.
The moisture आने की भीतर आल्यार automatically there is growth of organisms. So काय लागते, so keep it in an area which is dry. You
correct.
see, आम्ही बायला गावात or hotels आणि गेल्यार एक glass असता तो
Correct.
why? It is to dry.
Correct.
It is to dry the brush. So next time when you use it, again you wash it and then again. So that is what I would suggest also. And this is what textbooks and as well as research has told in a long run.
Correct.
That we can see.
Correct. डेंटिस्ट कशन गेल्ल्या वेळार व्हॉट आर द क्वेश्चन्स टू बी आस्क म्हळ्यार आमकां सदावत गोत्तुनागी सो एक डेंटिस्ट कडेन आमी गेल्ल्या वेळार कसली सवालां विचारची, कसली नॉलेज आमी काणोवची एक डॉक्टराक मेळिल्ल्या वेळार.
First and foremost, you either go with a complaint, as you said, toothache, yeah, this one, so that you talk to the dentist first. And कित्याक कायले खाल्याक कायले पण ते पयलींचे प्रॉब्लेम, let the dentist examine.
Correct.
Okay, first and foremost. Second question which a person can go is like, okay, I want to check my tooth, I want to check my oral cavity, म्हळ्यार म्हणजे यू नो दांत मात नाही, त्याचे सराउंडिंग स्ट्रक्चर्स म्हाका इल्ले तुमी चेकअप या तपासणे म्हणटात करन, आमकां तुमचे you know opinion clinical findings, yeah, suggestions they येता आमकां. So that is first and foremost.
Correct.
So either you go for to the dentist saying that you give me the outlook of my tooth, or I come with a complaint.
Correct.
So it is either one.
Correct.
So depending on that, the process starts. So that's the thing. Next thing, as I told you, we should be able to observe it. आम्ही हांगा दाग आयल्यार डर्मेटॉलॉजी कडेन धांवतात, फादर मुलं जण येतात, इल्ले दाग आयले पुरो, बिकॉज दांताचे कलर changes, you should be able to guess it out.
Correct.
So the same thing is thing is that, you know, you should be able to gauge by opening your mouth. You should know what is normal, what is, so that you can learn. Next thing, nowadays Google Baba is there. Okay, so many of them will first Google and पूरा बुलन पळयतात, कितले कॉस्ट कितले हे कितले approximately Mangalorean कितले, Bangalorean कितले, abroad कितले, and then they come to that, they know everything.
Correct.
So it is up to you. See, we all have to accommodate with the time. I cannot say that person who is using Google is little bit less than me or I am more than him. We shouldn't say that. We should be able to give our expertise as doctor. Yes, that impedes our clinical. कितें गोत्ता 10 क्वेश्चन येतात. Sometimes doctors also आमकां time ना.
Correct.
Because we are also impatient. We are same as human being. We are same human. थोडे न्ही oh doctor अशें बसल्यार आनी वगेत करून आयकल्यार oh he is a very good dentist or very good doctor. It is not that. Sometimes he also zones off.
Correct.
The तिसरे question गेला doctor. Okay. So it is good to ask pertinent questions and 1 or 2 questions, so that you can, then the discussion starts, because the doctor gives, because nothing is dictatorial here.
Correct.
It is on both of us how we go about it, because the doctor has to treat depending on the patient's needs.
Correct.
Because the patient cannot wear a gold denture first of all, he can't afford it, okay, and doctor can provide it.
Correct.
Doctor can provide a gold edge. He can tell his lab do a gold, but he has to be able to pay.
Correct.
Next thing, even if he's able to pay, will it look, because if he's like you on limelight every time, he smiles and yellow flash seller तुमचे camera पूरा बंद जाऊंगा.
Correct.
You understand? So
Correct.
these are many things which the doctor also tells. Okay, see, you don't go for this. Why don't you go? There's a to and fro.
Correct.
So approach. So with the dentist also, many a times, as you say, dentist is expensive. Yes, that expensive can be discussed.
Correct.
Can be discussed in a nice way, saying that I want to give you this way. Now, what is your take on this financially, or do you think? So that goes. Then we go like that. So understand. No, so building up even with a small filling. आता filling ही मुंचे. तो डनी मुंचे. Oh, filling आक 600 rupees करने के लिए. I सांगले वो सेस एक सिमेटाट. No, I don't want to take names. Okay, ते सिमेटाट वो thing 100 रुपये के अर्धो किलो मिलता. हम कहते 10 ग्राम आक 3,500 rupees थोड़े पटी पट्टा.
Correct.
Okay, so it is like that. For
Correct. Right.
it is how much you have the to and fro with the patient, that depends.
करेक्ट. आमच्या दांतांचो नॅचरल कलर लाईट येल्लो म्हणून हांवें आयकलां, पूण आतां तो एक व्हायटनिंग म्हणून एक पेस्ट ती पुरो येवंक स्टार्ट जाल्या आतां. सो हाचे विशय तुमची एक कमेंट काल म्हणटा डॉक्टर.
Start getting your children to the doctor from younger age. Don't scare them. Dentist ते दुख आयला पर ना आता दांत काडटा तो दांत काडीचे तशें नाही. You have to get, I tell, sometimes I send my patient children back, give them medication and send them back. Why? Because they have come, they have seen my clinic, they have seen who is the person. I have seen them, I have gauged them. Because हर एकल्या भुरग्यांक तुमकां treat करूंक जायना. There are people who are very unresponsive. Sometimes they are very, काय म्हणटात, cranky, or they shout. So I also gauge the patient. So dentist also can say that tomorrow, okay, we'll come tomorrow. Sometimes that's what everybody patients na. Patience na. So parents also, guardians also think, atta jaije. No, it doesn't go like that. So you build up a rapport. Get your child, get yourself, and gift yourself that. Automatically, once you gift that rapport, automatically, as you say, na, पहिलेंचे medicine नाचे कशे doctors, पूरा family ची history ಗೊತ್ತಸ್ತಲೆ.
Correct.
आता कोणाकी काले ಗೊತ್ತು ना, dentist कडे तक्षण बुरिया काढणार इल्यार, you are getting a child to an unfamiliar, very scary surrounding. ते सोड तुमकां गुत्ता आसा न्ही व्हिडिओ पेट्याक डॉक्टराक आतां म्हणटा ना काण एकत बटी धांवतात. तूं चिंत तो डॉबरमॅन इतलो फिरोशस जाल्ल्या री ते वेटनेरियनाच्या क्लिनिकाच्या स्टेपार पडटना कसो जाता. Same thing. So that is why unfamiliarity and the unfamiliar surroundings, we introduce them from a small age and say this is a dentist. See, you automatically you build up rapport, and that rapport will help up. That's what from your own awareness point of view. Thank you very much. See, that is depending on celebrities like you.
No, I'm not a celebrity.
Okay. Now, if celebrities like you, would like to look good, yes, because you know how to carry yourself. Very important, because whitening, remember, it destroys a little bit of the tooth structure.
Right.
A little bit. Okay. And it gives it a crystalline, the crystal structures automatically maintenance asataka.
Correct.
So if you cannot maintain it, again you go now as example, ami piyonche pura kappan vegine.
Correct.
Kappan. Have you seen people drinking with straw abroad? Everything through with straw.
Correct.
Why? This is to protect their teeth.
Teeth, right.
They drink Coca-Cola also through
straw. डायरेक्ट
तुम्ही बाहेर आले ते गुत्ता. Okay.
Right.
आम्ही पूरा सिप करतात because straw goes directly into the throat. Okay. So you bypass the teeth.
Correct.
So if you can maintain all these things, because we want to eat chicken tikka masala full yellow अंगात रेड जाता ते भितर कित्याक स्टेन जाता.
Correct.
So if automatically आम्ही ब्लिचिंग करताना दांताचे ब्लिचिंग करताना पोर्स ओपन जाता. आम्ही हांगा ब्लीच करता वय की नाही.
Correct.
पोर्स ओपन जाता ते पोर्स मायक्रोपोर आमकां दिसना.
Correct.
बट दॅट इज वॉट इज हॅपनिंग इन रियालिटी. म्हणजे रियालिटींत पोर्स ओपन जाता ऑटोमॅटिकली त्या पोरा भितर ते स्टेन वेता, ते कलर वेता, आणि ते स्पोर ऑटोमॅटिकली लो बंद जाता, क्लोज जाता. क्रिस्टलाइन स्ट्रक्चर ते क्लोज ऑटोमॅटिकली ते स्टेन थंय उरता.
Right.
Now every time you do the same thing, it goes deeper and deeper and deeper. Automatically, kadche kas jata.
Correct.
So that is why all these whitening and all, yes, sometimes you can use very light milding or something you can use. Nowadays you have the violet paste and all that thing or something. You can that is up to you. But how do you maintain is the question mark.
Maintain, correct.
त्याच्यात ते whitening केलं तर next second आगोसून aerated drinks पिये या carbonated drinks पिये, it will affect the tooth structure and then it causes more damage.
Correct.
So first thing and next thing, see, with celebrities, I would say, they know that, they know how to maintain themselves, they know all these things. The 10 times they've been told, they have managers, "Yen piya na kattat."
Correct.
Okay, so they know that to maintain, because it is costly also an affair
Correct.
for them, because to look good, and they have people with the, so if you have that type of system and people around you, or your mindset is like that.
आता ज्वेलरी घालची एक ट्रेंड स्टार्ट जाला, दांत येंकन तो एक काय म्हणतात डायमंड ब्रेक घालचे आणि
yes,
पुरा
yes.
सो ते केदाळे हेल्दी नी म्हणून तुम्ही सांगचे.
एक्झाम्पल आम्ही खाणा गल्लांगा ओके थोड्यांनी सांगले तू सुबी दिसताय थोड्यांनी, इट इज सब्जेक्टिव्ह पर्स्पेक्टिव्ह अँड द अदर ऑब्जेक्टिव्ह, हाऊ दे ऑल्सो लुक एट मी अँड हाऊ, बट इफ आय फील कॉन्फिडंट इन दॅट, वाय नॉट गो फॉर एनिथिंग. आता ब्रेसेस युजली म्हणचे, ब्रेसेस आय डोंट फील देर आर सम, आय टेल हाफ ऑफ माय पेशंट, डोंट, वाय डू यू वॉन्ट, यू लुक गुड.
करेक्ट.
So and so, there are so many actors in the film industry who have crooked teeth, and I like, why don't you be natural?
Correct.
Why is that you always have to go for straight alignment?
Correct.
If you know to brush well, clean well, floss well, and go to a dentist correctly every year, why not?
Correct.
But when people, that's what I said, no, putting bedazzling your tooth, म्हणतात, bedazzle करतात ना, okay, bedazzling your tooth and all that, that is you, up to you. There are people who have come and told, "Maka the gold ache crowns hai." आम्ही करून दिला.
Correct.
We have done of Japanese gold, okay. But 4 ग्राम दीजे पडटले ना त्याला बघा. Okay, मागीर आम्ही मेल्ट करणं ते, मागीर वेस्टेज ते, again I don't have calculations.
Correct.
Okay, I'm not that deprived dentist who look calculative.
Okay.
So that's like a public health dentist puro.
Okay.
So you can, it is up to the perspective of the client if he can. So that's what, I don't say anything you because even if a dentist gives you, he also advises you.
Correct.
Remember one thing, it is a two-way approach.
Correct.
So he will advise you to, because anyhow you have trusted him.
Correct.
First and foremost, and he wants you to come back.
Correct.
So he will do the best to convince you in all the ways to keep it in that way also.
Right.
I don't think so, no dentist will say झाले कारण वोस म्हणून.
होय तशें तर पाटी म्हळ्यार केदाळे पाटी येवचे डॉक्टरांनी तुम्ही जी येचे
होय, होय,
एक कोटी
correct,
माझी पाटी येना
correct.
जाल्यार तुम्ही
आमी केदाळे तेंक सांगचे, okay, that's why we dentists are there, no. Paste येवन दीत, brush येवन दीत, okay. कितले, but dentists are there because some things procedural, okay,
Correct.
which we are there, and this is our trade, this is our profession, and this is what God has probably made us to be. So that is what, so we have to look at in everybody in that way.
ओके सो निमाण एक सेगमेंटाक येता आसतना ॲज अ पब्लीक हेल्थ डेंटिस्ट तशेंच एक डेंटिस्ट जावन आमच्या लोकांक तुमी एक खोल संदेश दिवंक आशेतात.
Very importantly, दांताचे या तोंडाचे health, okay, is very important. As we began with that medical health we only look at sugar, BP and all that thing. Everything can be also controlled with your oral health. Very importantly, do your once in a year checkup always, so that your oral health is good. Next thing, automatically when you can eat, bite, taste, or you feel happy in life, because end of the day people like me, us are foodie, okay, but I know most of us are foodie. Why? Because you see the number of restaurants are booming, okay, and that too are authentic restaurants and all. Why? Because people, end of the day, food gives pleasure also. For those people who don't, they look at their aesthetic, subit, so buy zaiche. So these things can be helped up with the dentist. So I always advise people, be prudent of your health as well as oral health, because health you have to look at everything. You cannot say that but you have to look at it overall. So my advice is that's it, take care, and once in a year dental checkup.
येवन पळया. ओके डॉक्टर, तुम्ही बऱ्यांतले बरो संदेश आमच्या लोकांक दिला. सो आय होप तुमकां कार्मेल कॅफे किंवा तुमकां खुशी जाली म्हणून हांव पाती येता.
Oh yes, thank you very much for this opportunity. Just want to say I am in Father Muller's, तुम्ही सांगले बरे, Father Muller's professor in dentistry department, but the liaison officer for the charitable institutions. So you will see more of administrative role for me there, and dentistry, our team is quite good. I think Dr. Jyoti had recommended, and there are the whole team. So please do visit. We have a very plush OPD now, okay, but the rates are very controlled. So you can come, you can discuss with the issues there, and when you come here, the ambience is different. You have your time and doctors are available, so we are all there, so you can even ask for me. So do come, and Father Muller's is always there for everybody, irrespective of caste, creed and religion.
करेक्ट अशें म्हणटा आसतना डॉक्टर कॅल्विन बिजी आसचे मनीस आज काही कॅम्प आसा काही हॉस्पिटल आसा काही दादल्यारी आमच्या एका आपोण्याक तांणी जायत म्हूण सांगून 2 पुटी आमी एकामेकाक मेळ्ळ्या उलयल्या सुमार डिस्कस कर मागीर हो एपिसोड आमी हांगासर कर नासोन देखून मस्त टायम आमी एपिसोडाक दिला देखून डॉक्टर कॅल्विन तुमी पब्लीक हेल्थ म्हणल्यार पब्लिका खातीर करचे ह्या सेवेक हांव तुमकां एक देव बरें करूं म्हणटा आसतना तो बाळोक जेजू तुमचेर तुमच्या कुटुंबाचेर कित्याक तुमचे पतीन डॉक्टर टीना जाल्यार डेंटिस्ट दोगांय डेंटिस्ट गोबायला तुमी बरे मस्त सेवा आमच्या लोकांक तुमी दिवन आसात तुमच्या कुटुंबाचेर तुमच्या दोगां सुबीत बाळांचेरय तो देव आशिर्वाद घालून दी तुमी आशिल्लें मागलें पुरा तुमकां दिवन तुमची जिणी बरी जावन दी म्हणून सांगून हांगा हांव तुमचे खातीर मागता
थँक्यू, अँड देव बरें करूं म्हणटात आमी. ओके, थँक्यू व्हेरी मच.
येस तर मुगोचे विक्षकांनो आयचो एपिसोड पसंत जालो जाल्यार तुमकां गोत्त सकाळीं करूंक शेअर करा आता तितल्या लोकां लागीं इन्फॉर्मेशन वचून दी कित्याक ह्या दिसांनी ओरल हेल्था विशयांत चड आनी चड माहिती लोकां वेची गरज आसा देखून दयाकन एपिसोड शेअर करा कितें बरें लागलें बरोवन तिळसिया कितें बरें करीत आसलें तेंय आमकां कमेंट्सांनी तिळसिया तशेंच मुख्य एपिसोडांत आनेक बऱ्यांतलो बरो एक टॉपीक घेवन तुमच्या मुखार येतली देखून आमच्या कार्मेल किरण चॅनलाक सबस्क्राईब करूंक विसरा नाकात. सो मेस्तांक येवच्या हप्त्यान परत मेळटा वरेक देव बरें करूं.